How do epidemics and public health crises affect minority groups, and especially Roma communities? My name is Raul Cârstocea, and in this masterclass, I will talk to you about the impact of COVID-19 on Roma communities and place it in historical perspective. In spring 2020, as the first wave of the COVID-19 pandemic prompted social distancing and lockdown measures across Europe, some alarming reports emerged from NGOs and media regarding the increased vulnerability of Roma communities to the effects of the pandemic. These were doubled by even more alarming reports concerning an increase in the incidence of hate speech, online and offline, and even racist attacks against Roma. The context for this is one that is familiar to us Roma. Roma communities are among the most discriminated minority groups in present-day Europe, as communities living mostly in rural or deprived urban areas, having a much higher poverty rate than the majority population, and often experiencing poor housing conditions, including overcrowding and limited access to clean water, it is understandable why the Roma have been much more vulnerable to the effects of the COVID-19 pandemic. The pervasive racism and stereotyping against Roma were reflected in allegations about their poor hygiene and lack of compliance with social distancing rules, with the result that this minority group was often scapegoated for allegedly spreading the disease. It was in this context that I led a team of researchers on a project entitled Marginality on the Margins of Europe, the Impact of COVID-19 on Roma Communities in Non-EU Countries in Eastern Europe, funded by the Global Challenges Research Fund of Research England. In addition to myself, at the time working at the University of Leicester, the team included partners from the European Centre for Minority Issues in Flensburg, Germany, as well as local researchers, Roma and non-Roma, in each of the 7 countries covered by the project: Albania, Bosnia and Herzegovina, Moldova, Montenegro, North Macedonia, Serbia, and Ukraine. Our project aimed to contribute to an evidence-based understanding of the impact of COVID-19 on Roma communities. Given the multiple vulnerabilities of Roma communities on account of their poverty, social exclusion, and pervasive racism targeting them, the project was driven by 2 main research questions. The first question sought to clarify the impact of the pandemic and of the measures intended to contain its spread on the ability of Roma communities to 1. Access healthcare services, 2. Participate in education, 3. Maintain their employment status, and 4. Housing conditions. The second question focused on the emergence of acts of discrimination, racist incidents, and hate speech targeting Roma communities in the context of the pandemic, and the responses of the local and national authorities to such incidents. In this talk, I will briefly discuss the results of our project and place them in a historical context, where I will discuss the scapegoating of minority groups, including but not limited to the Roma, in times of epidemics and pandemics. In my view, this is very important as a safeguard against exceptionalizing either the recent pandemic or the Roma minority. My approach to such incidents is one where cultural or linguistic understandings of what a national minority is need to be complemented by considerations related to their position in the economy. I argue that hate speech and racist incidents against the Roma in the context of the COVID-19 pandemic, and more generally, are better understood by factoring in the intersection of race and class, where the long-standing racialization of the Roma in Eastern Europe is very much based in their socio-economic marginalization. My talk is structured in 3 main parts, followed by a conclusion. First, I present some of the findings of our research project that point at the increased vulnerability of Roma communities to the COVID-19 pandemic. Second, a short historical overview of societal responses to epidemics and pandemics will show that minorities and the poor, and even more so groups that were simultaneously ethnic, cultural, and linguistic minorities and marginalized groups experiencing poverty, were frequently scapegoated and subject to social violence during epidemics. Third, I will show that these patterns were amply on evidence during the COVID-19 pandemic when it came to Roma communities. Some conclusions follow that argue for taking poverty and considerations of class more seriously when discussing anti-Roma racism or anti-Gypsyism. In order to argue that, I will start from some data that we got from our research project on 4 key categories: access to healthcare, education, housing, and income, showing quite visibly that Roma communities were more vulnerable to the effects of the pandemic than majority populations. Our study adopted a mixed methods approach, combining quantitative data derived from online surveys with qualitative data obtained from semi-structured, in-depth interviews carried out with relevant stakeholders from or involved with the Roma communities in the 7 countries in question. The field research was carried out by local researchers, and the resulting data was contextualized with the help of desk research, aimed primarily at a close reading of media sources in the relevant languages, including both mainstream and social media. The quantitative data revealed the disproportionate impact of the COVID-19 pandemic on Roma communities across 4 main categories: access to healthcare, housing, employment, and education. A differentiated effect was noticeable when factoring in gender, with Roma women being more affected than men by the lockdown measures, especially with respect to education, where pre-existing gender inequalities within the communities were exacerbated by the pandemic. In the context of a pandemic, the most important such area of social services is that of access to healthcare. Here, it is important to note that, according to EU reports, Roma communities already experienced higher rates of chronic disease and substantially lower life expectancy compared to non-Roma before the pandemic. As a result, a disease that was exacerbated by what came to be known as pre-existing conditions was potentially much more dangerous and even deadly. Just as more than half of the Roma people we surveyed mentioned that they avoided medical services due to fears of becoming infected with the virus, extensive evidence shows that both mainstream and social media were constructing an image of the Roma as virus spreaders. As a result, 19% of the respondents to our survey reported that they felt discriminated in their access to medical services because doctors were often suspicious of admitting Roma to medical facilities. In one particularly tragic instance, a 9 months pregnant Roma woman died because she was denied emergency medical care while waiting for the results of a COVID test in North Macedonia. Another key area where structural inequalities became very visible during the COVID-19 pandemic was education. Due to the pandemic, all countries instituted some form of remote learning, whether in the form of online schooling through mass media or via the distribution of printed homework. 86.5% of the respondents to our survey across the 7 countries stated that remote education was not available to them. The interviews we conducted referred to the lack of computers and/or the lack of an adequate internet connection as some of the most important barriers to participating in remote education. This was supported by the survey data, where 55% of respondents indicated the lack of a computer and 43% the lack of an adequate internet connection as the main barriers to remote learning. Additionally, 34% of the respondents across the 7 countries said that remote learning increased costs for the household. While aware that the limitations of online schooling affected the population at large, not just the Roma, our survey additionally indicated that 18% of respondents felt their children were being discriminated against during the lockdown period in relation to their access to education. This adds to long-standing concern about discrimination against Roma, affecting the quality of education of Roma children across Europe. With regard to housing, another area in which Roma experience discrimination, our research focused on 2 main issues: the availability of suitable space for observing social distancing measures, on the one hand, and financial problems related to housing, on the other. With regard to the first of these, only half of the survey respondents indicated they had adequate space within their homes to obey lockdown rules. The lack of clean tap water was a consistent issue reported across the 7 countries. The Roma persons we interviewed also mentioned that many homes did not have sufficient space for obeying social distancing rules, while lack of space also constituted an obstacle to children's access to education, in that they did not have adequate space for attending remote education without being disturbed. In terms of financial problems related to housing, while evictions were not common, mostly due to the state prohibitions on evictions in the lockdown period, the main issue appears to have been affording household bills and utility costs. 9% of the respondents to our survey were cut off from a utility, heating or electricity, and so on, during the lockdown. This last aspect brings me to the issue of the impact of the pandemic on the income of Roma families, which also provides the most dramatic figures. 71% of the respondents answered that the lockdown had an impact on their ability to work, while 73% agreed that their income had been reduced as a result of the pandemic. This comes against the background of extensive data showing that Roma have long faced challenges in the labor markets across Europe. EU-level statistics show that the share of Roma in paid work is only 43%, a number which declines to 29% for Roma women. Consequently, going into the pandemic and the lockdown period, Roma were already at risk compared to majority populations due to their extensive engagement in the informal, temporary, precarious labor sector. The data collected in our research confirms this, showing an over-reliance on informal work. Only 22% of our respondents were in permanent regular employment at the time of the pandemic, as well as reporting reduced income due to the inability to work. As a result, the ability to afford essential items also declined drastically, and the necessity to borrow money grew. 32% of survey respondents felt they could not afford food and household essentials, and 73% indicated they needed to borrow money to make ends meet during the pandemic. In terms of government assistance, only 36% of the Roma people who answered our survey were aware they existed, and only 24% of the total respondents applied to them. The main takeaway from our data on employment and income is that Roma were greatly affected financially by the COVID-19 induced lockdown measures, as already existing precarities were being accentuated. Okay, so what does this all mean? The data I just went through clearly points towards structural inequalities across four key areas associated with standards of living, from healthcare and access to education to housing, employment, and income. Roma communities were disproportionately affected by the pandemic compared to majority populations. This points to their vulnerability in crisis situations like epidemics or natural disasters. Moreover, and adding to their vulnerability, stereotypes about the Roma regarding poor hygiene, disrespect of the rules, or socially deviant behavior led to a veritable campaign of scapegoating Roma communities and blaming them for the spread of the virus. Such instances, I think, can be best described as indicative of what Paul Farmer, an expert on the effects of health inequalities on human rights, has termed structural violence, which he defines as a broad rubric that includes a host of offensive against human dignity, extreme and relative poverty, social inequalities ranging from racism to gender inequality, and the more spectacular forms of violence that are uncontestedly human rights abuses, some of them punishment for efforts to escape structural violence. Such instances of minority groups, including the Roma, being blamed for the spread of diseases were by no means new, but are instead familiar to historians working on epidemics and pandemics in history. One of the things we constantly heard on the news regarding the COVID-19 pandemic was its unprecedented nature. While this may be true in terms of the scope of the measures adopted to contain its spread, due to the increased state capacity to intervene in society, none of those measures were new and certainly had plenty of historical precedents. Individual quarantine of infected persons is documented as a form of prevention since the Old Testament, and the locking up of houses, mandated by the city authorities, was a widespread practice during the 1665 Great Plague of London, as we know from Daniel Defoe's Journal of the Plague Year, for example. Closer to our topic today, placing blame on minority groups is well documented in the historical record, at times leading to outbursts of mass violence. The most violent and well-known such incidents are the mass burnings of Jews during the bubonic plague epidemic in 14th century Europe, the so-called Black Death, when Jews were blamed for poisoning wells and thus causing the pandemic. They are also visible in more recent epidemics, such as outbreaks of cholera in 19th and 20th century. The standard interpretation sees such patterns as attempts to reassert some sense of agency when confronted with uncontrollable disasters, whereby blaming serves as a means to make mysterious and devastating diseases comprehensible and therefore possibly controllable, as Dorothy Nelkin and Sonder Gilman argue. In the context of the COVID-19 pandemic, such a reading could indeed account for the scapegoating of the Roma as a means to cope with uncertainty, reinforce moral values, and importantly, uphold existing hierarchies, underpinning Roma marginalization and reproducing it. However, zooming in even closer to the historical record of reactions to epidemics and pandemics reveals a more complex picture, where a group's minority status is compounded by other factors, notably a class component, where the etiology, pathology, and transmission patterns of different diseases also play an important role. In a 1952 article, René Berel pointed at the importance of class hatred surfacing in times of epidemics, both of the rich viewing the poor as a dangerous class, and of the poor accusing the rich of deliberately poisoning them in order to reduce their numbers. The cholera riots of the 19th century provide ample evidence of this across Europe, from the Russian Empire to Ireland, whereas the reverse situation could be witnessed with social violence during smallpox epidemics in late 19th century Canada and the United States. Evidence of the poor bearing the brunt of pandemics is well documented ever since Defoe's Journal of the Plague Year, even in the case of the bubonic plague, a disease that killed indiscriminately and spread easily, including through inhalation of infected respiratory droplets like COVID-19. Such evidence was all the more visible with epidemics such as cholera, very much a social disease, where the chain of transmission is significantly facilitated by limited access to clean water sources and the bacterium's passage into the intestine by poor nutrition, or typhus, spread by fleas or lice, for which poor sanitation and overcrowding act as major risk factors. It was not just the etiology of cholera and its differentiated impact that disproportionately affected the poor, but also its symptomatology that was conducive to class antagonism and social violence. The disease is famously gruesome in its pathology, has a high case fatality rate, and the violent death through extreme expulsions of liquid from the digestive tract ensues very rapidly, in some cases in a matter of hours. Moreover, as Frank Snowden, a historian of pandemics, argues, cholera continues to horrify even after death, as it produces vigorous post-mortem muscular contractions that cause limbs to shake and twitch for a prolonged period. This led to suspicions that victims were being buried alive. The fact that its 19th century onset coincided in many places with the establishment of the first hospitals, to which the afflicted were taken and from where very few returned, the violent symptoms recalling poisoning, and the strict burial regulations that called for immediate burial in separate grounds and excluded family members from participating, led to notions of a diabolical plot to destroy the poor in a literal class war. The fears of the poor were fueled by the behavior of the authorities, who intervened in force, often sending in the army to assist the local police, and cordoned off entire areas of the affected cities, invariably those in which the poor lived. Healthcare workers and disinfection squads conducted themselves almost like an army in enemy territory, Snowden claims. At a time when newspapers were rising in prominence, their accounts of the cholera riots in Naples referred to the population of the lower city, an area notorious for its poverty and unsanitary conditions, as beasts, rabble, idiot plebeians, and mobs. The association of social violence with 19th and 20th century cholera epidemics is impressive in its geographical spread, from the United States across all of Europe and into the Asian parts of the Russian Empire, reaching as far east as China and Japan. Despite the differences between these societies, authorities reacted very similarly, blaming the poor and the marginal, the Irish in Liverpool and Glasgow, tribal Sarts in Tashkent, fig growers in Puglia, peasants in Hungary. Bourgeois elites blamed cholera epidemics on the irresponsible behavior and alleged ignorance of the poor without any serious consideration of the terrible living conditions that exposed them to the disease. In turn, these dangerous classes responded to the quasi-literal war waged against them by the authorities' militarized response to cholera outbreaks by rioting. The social violence accompanying cholera epidemics also provides a good example of how class hatred could shift to violence against minorities. Importantly, this feature became more prominent toward the end of the 19th century, in the 1880s and 1890s, continuing into the 20th. This aspect acts as a corrective to a widespread notion that violence against minorities in the context of pandemics occurs when diseases are mysterious, their causes unknown. By the late 19th century, the germ theory of disease, associated with the so-called laboratory revolution, had identified the causes of cholera and of other diseases in bacteria and viruses, debunking the earlier miasma theory that had viewed such epidemics as being caused by bad air emanating from rotting organic matter. However, the violence did not abate with the scientific understanding of diseases and the identification of the microscopic pathogens that caused them. Cholera riots across the Russian Empire in the late 19th century variously targeted Jews, Persian merchants, and Armenians, with a class component overlapping ethnicity in all these cases. Italians in 1910 blamed the cholera epidemic on Jews and especially on gypsies, claiming that poison began with those groups. Such rumors that gypsies were spreading cholera in 1910-1911 were endorsed by the Italian government, incidentally led by a Jewish prime minister, which eventually expelled them from the cities, thereby encouraging incidents of mob violence against them, as another historian of pandemics, Samuel Cohn, shows. Roma, or gypsies as they are identified in the historical record at this time, were in fact rarely absent from the usual suspects associated with the spread of cholera. This was due to their double exposure, on the one hand being invariably among the poor, whom the disease affected disproportionately, and on the other hand, due to their frequent employment as cart drivers carrying the corpses of the dead, which, as we saw, often still showed signs of what appear to be signs of life, to mass burials. Now, for people who are much more exposed to a disease than others, two contrasting things can happen: a higher incidence of the disease and increased mortality among that group, or, when that does not happen, prolonged exposure to the pathogens can induce immunity. Both of these were visible among the Roma during cholera outbreaks during the 19th and early 20th century, and both rendered them suspicious. If too many of them got infected or died, they were feared as spreaders of the disease. If too many of them appeared particularly unaffected, as the cart drivers would be, for example, after touching so many corpses, this brought up suspicions of magic or witchcraft. In fact, among the nicknames given to cholera, one was the gypsy, another was the monster. If cholera was the prime example of a social disease that disproportionately affected the poor, smallpox was much more indiscriminate due to its mode of transmission through air, affecting all social classes alike. Moreover, two other factors rendered smallpox an unlikely candidate for social violence. First, smallpox was more or less an endemic disease of childhood, although outbreaks of particular intensity did happen. Consequently, it lacked the shock factor that cholera and other epidemics possessed. Second, as of the late 18th century, it was preventable as a consequence of the world's first vaccine, an effective one developed by Edward Jenner on the basis of the related but far less harmful cowpox virus. Interestingly, and similar in many respects to popular reactions to the COVID-19 vaccine, mass mobilization and violence against the vaccination campaign in England, the first instance of a nationwide vaccine rollout in history, occurred, culminating in the establishment of a national anti-vaccination league. In late 19th century North America, the social violence accompanying smallpox outbreaks targeted once again the poor, while having a much more prominent racist component than the cholera riots. The first thing to note here are the different dynamics of the violence. Unlike in the case of cholera, where the violence was much more two-sided, including rioting by the poor against health officials and privileged groups, as well as violence by the state authorities against the dangerous classes, smallpox violence was decidedly one-sided, always instigated by the elites and the middle class against the poor and the marginal. However, rather than being indiscriminate, violence in response to smallpox targeted others: the Chinese, Native Americans, and African Americans, while those who engaged in violence were always white men. At the time of mass migration to North America, immigrants, perceived as racially distinct, were frequently the targets of armed vigilante gangs. The Chinese especially were frequently blamed for smallpox, with organized violence targeting Chinatowns from Calgary to San Francisco. The fact that smallpox was both well understood and preventable at this time argues against interpretations that see the scapegoating of minorities as a reaction against mysterious diseases. Instead, they add weight to Samuel Cohn's hypothesis that modernity, instead of decoupling the disease-hate nexus, intensified its lethality. With the colossal exception of the Black Death, with its massacres of Jews, beggars, and others, it was the 19th and 20th centuries which produced the major outbreaks of disease-provoked violence and blame, and they did so when diseases such as smallpox and cholera no longer posed great mysteries. In one particularly genocidal instance, I would add, both Jews and Roma were blamed by the Nazis during the Second World War for the spread of typhus, and they were murdered in actions seen along the lines of sanitary measures. Despite its targeting of marginal groups, we might then read instances of epidemics-related violence not as peripheral to societies, but as constitutive of a modernity where public health issues are being coded along racial and class lines. In a pattern familiar from studies of whiteness, examining how different migrant groups to the United States gradually became white through social mobility into the middle class, in some cases transforming from marginal others not just into deserving citizens, but even model minorities, some minorities could integrate into mainstream society over time and consequently become part of the so-called healthy body of a nation. As Samuel Cohn shows, not just the Chinese, but also the Bohemians, Germans, and the Italians who were blamed for the 1881 to 1882 smallpox epidemic in New York, Chicago, and St. Louis, because of their supposed ignorance and hostility to vaccination, would no longer be counted among the poor by the 1930s, with marginality being pushed further afield the racial gradient. The picture that emerges when comparing different epidemics in different times and different places is one where societies not only sought to reinforce their pre-existing boundaries of proper, acceptable behavior in times of catastrophe, but also built those boundaries in the process. The targeted groups could differ based on the disease, its causes, symptoms, and transmission, as well as on the segments of society that were most affected. Some affected the old more, some affected children more, others, like the Spanish flu, mostly affected healthy adults in their prime. As the case of that ultimate indiscriminate killer, the bubonic plague shows, the assemblage of the guilty and the dangerous could also be very heterogeneous. Tricksters, gypsies, negroes, knaves, herbalists, street singers, comedians, whores, and similar oddballs were expelled from Florence during the plague of 1575 to 1578. Despite their diversity, what these groups had in common was an association with deviance, with disregard for public order, and with the crossing of boundaries, reminiscent of what the anthropologist Mary Douglas calls matter out of place. The Roma, or Gypsies as the group was referred to in the historical sources, were consistently blamed for spreading different diseases and frequently victimized. While other minority groups, such as the Jews or the Chinese in the United States, eventually left this space of marginalization, the Roma in present-day Europe are still there and have not become white, mostly because the majority of them have not become middle class. Other notions of Roma crossing boundaries, whether in fantasies of mobility associated with the now long extinct nomadism, allegations of immorality, or accusations of criminality, come together in an image of deviance based on both class and race, posing a threat to hegemonic notions of bourgeois morality and proper behavior. All of these aspects were very visible also in the case of the COVID-19 pandemic. Some of the most egregious instances of racially motivated actions by the authorities and violent attacks by non-state groups or individuals were reported in the local, regional, and national media and can also be found in reports by NGOs and international organizations monitoring anti-Roma racism during the COVID-19 pandemic. These included cases of police brutality, racial profiling, and the quarantining of a group of Roma musicians at the border in North Macedonia, police and far-right violence in Serbia, the arson of a Roma camp by the paramilitary neo-fascist group C14 in Kiev, and orders to deport the Roma issued by the far-right mayor of Ivano-Frankivsk in Ukraine. The mainstream media coverage in the 7 countries we included in our project consistently included racist references to the Roma and directly blamed them for either spreading the virus or for violating lockdown restrictions. The pattern emerging from all these is in line with 2 common stereotypes about the Roma that were rendered salient by the pandemic: allegations of poor hygiene and propensity for breaking the rules. Both of these are understandable when factoring in both deeply embedded anti-Roma racism and the peculiarities of the COVID-19 pandemic, especially when placed in the long historical context that the first part of this presentation has provided. Hardly mysterious, SARS-CoV-2, the coronavirus that causes COVID-19, was well understood and genetically sequenced even before the pandemic reached Europe. As work on a vaccine was still a long way away from completion in the spring and summer of 2020, calls for personal hygiene rules meant to prevent the spread of the virus, doubled by state-enforced lockdowns, were the norm in early responses to the pandemic. In both cases, they intersected with the aforementioned anti-Roma stereotypes, which explains why they were singled out and blamed in societies across Eastern Europe and beyond. The mainstream media, as well as non-Roma, blaming the Roma for spreading the virus on social media, fell back on cultural interpretations, pointing at what they described as the nature of the Roma. Instead, our project data points emphatically to poverty and marginalization as the main aspects characteristic of the particular situation experienced by Roma communities during the pandemic, transformed by majority populations according to pre-existing racist tropes into a cultural argument. I already mentioned that our survey data with respect to housing revealed that 31% of the respondents felt they did not have enough room to comply with lockdown rules within the household. This is consistent with reports by international organizations monitoring the living conditions of Roma. In a joint statement issued on International Roma Day 2020, the OSCE Office for Democratic Institutions and Human Rights, ODIHR, and the EU Agency for Fundamental Rights pointed to overcrowding and poor access to sanitation linked to, I quote, long-standing Roma discrimination and marginalization as the aspect rendering them particularly vulnerable during the pandemic. Limited access to clean water is a well-known feature of the poor living conditions experienced by Roma communities across Europe, and one that became very important during the COVID-19 pandemic. In one case, reported by one of our interviewees from Serbia, persons belonging to the Roma community had no water in one settlement in Belgrade. When they left it to get water from a local reservoir, as they usually did, the police fined them for violating the curfew rules. The example above clearly shows this connection between poverty and the two most common racist ideas vehiculated about the Roma in the context of the COVID-19 pandemic, i.e., poor hygiene and lockdown violations. The connection becomes even clearer when taking into account the impact that the lockdowns had on Roma persons' ability to work and the effect this had on their income, translating into increased inability to afford essential items or pay for household utilities. The nexus of poverty, informal employment, stereotypes about poor hygiene and the propensity for breaking the rules as components of pandemic-related anti-Roma racism can be illustrated with an example encountered in the case of Albania. All 9 persons we interviewed in Albania referred to recycling of scrap metal, plastic, glass, and so on as one of the main types of informal employment for members of the Roma community, up to 60-70% of them in some localities. As this occupation was discontinued due to the lockdown and the hygiene rules, the recyclers lost their primary or even sole source of income, as a result of which they could no longer afford food. Consequently, some of them violated the lockdown rules and continued recycling. This was answered with police brutality, with images and a video of police physically abusing Roma recyclers going viral on social media. In turn, this prompted a wave of hate speech online, establishing not only a connection between recycling work and spreading the virus, but also with the racist trope of the so-called dirty Roma. In the words of one interviewee, Roma also have been defined as dirty people, as people who spread the virus and who do not respect the social distancing. I stay inside and Roma stay on the roads. Why should I be infected by them? In a way, there has been a growth of distancing between the Roma and the non-Roma. Due to this, people are split into 2 groups, the dirty ones and the clean ones. And I end the quote. The director of a Roma NGO explained these lockdown violations matter-of-factly in connection to poverty, saying, and I quote, that was the only business that could provide money for food for them. However, in the eyes of a majority population who had normalized anti-Roma stereotypes of poor hygiene and rule-breaking, this was interpreted as further proof of the inherent dirtiness of the Roma, effecting a division of society separating the pure from the impure. According to the anthropologist I mentioned earlier, Mary Douglas, our idea of dirt is compounded of 2 things: care for hygiene and respect for conventions. Both of these notions came to occupy center stage in the context of the first 2020 lockdown, and an element of danger was clearly attached to impurity, with the Roma identified in Eastern European societies as the primary transgressors. Although particularly visible in the Albanian case, the involvement of the Roma in recycling and the problems it led to during the lockdown was by no means limited to this country, with similar stories being reported in Bosnia and Herzegovina, Montenegro, North Macedonia, Serbia, and Ukraine. In terms of the violence directed against the Roma, the pattern that emerges across the 7 countries we studied is that it was undertaken primarily institutionally, driven by the authorities. The only exceptions in this respect were Serbia and Ukraine, where far-right groups, the Leviathan movement in Serbia and the C14 group in Ukraine, attacked members of the Roma community. In Kyiv, 2 members of C14 carried out an attack with tear gas on a Roma camp, which they then burned to the ground. Ukraine was also the only country where violence by neighbors against the Roma community in Konotop was recorded and reported to the police. Outside of these exceptions, most of the violence took place online, ranging from jokes and racist memes through more serious racial slurs to instigations to violence as a means of preventing infection. Our interviewees in several countries consistently pointed out that hate speech against Roma was widespread on social media. In turn, 2 interviewees in North Macedonia claimed that actually it was the mainstream media that's a trigger for the hate speech in the general public, and that reactions on social media arose as a response to that. Nevertheless, violence from the authorities was much more widespread than any incidents involving non-state actors. Police brutality was the most common and was reported in interviews and desk research everywhere. Other human rights violations included racial profiling, with only Roma being stopped for questioning on the street, as well as instances of selective lockdowns, where Roma were prevented from leaving their neighborhoods where they lived, despite the absence of any formal lockdown measures. As pointed out in an interview in Moldova, this happened, and I quote, especially in cities densely populated by Roma, such as Soroca, Otac, or Edinets. There were also abusive fines, illegal fingerprinting, imprisonment, beatings, and even torture of Roma persons who were infringing lockdown measures. The picture that emerges across the 7 countries we researched is one reminiscent of the brutal interventions of the authorities in poor neighborhoods during cholera epidemics that I was mentioning earlier. Although the police was singled out as the most serious offender, which is consistent with its function of enforcing the lockdown and curfew rules, cases of hate speech and institutional violence were also reported in relation to other authorities. In Ukraine, health authorities refused services like sending an ambulance or admitting a woman about to give birth to the maternity ward to Roma, and publicly named and provided the addresses of Roma who had been diagnosed with COVID-19. In Albania, one of our interviewees stated that, I quote, the hate speech comes especially from the politicians, while a Roma community mediator in Moldova pointed at the racism of a local elected official which he had employed in his electoral campaign. The worst such incident carried out by elected politicians occurred in Ivano-Frankivsk, where the mayor Ruslan Marcinkiv, a member of the far-right All-Ukrainian Union Svoboda party, called for the forced eviction of Roma residents and their deportation to Zakarpattia, under the pretext of members of the community having violated the quarantine. Even more worryingly, many interviews indicated that people were afraid to report racist incidents or even to discuss these under conditions of anonymity because they feared more serious repercussions. The lack of trust and even the fear that the Roma have of the authorities is entirely understandable, given the authorities' propensity to racism and violence. Also reminiscent of the social violence during both cholera and smallpox epidemics that I mentioned earlier is the pronounced class dimension of the violence against Roma during COVID-19. Outside state institutions, an interesting feature that came out from some of the interviews with regard to online hate speech was that the persons driving it were identified as intellectuals, educated, middle class, well-off people. The class dimension was also visible in distinctions made among the Roma, as with the case of a quarantine of a Roma neighborhood where, for some reason, the interviewee said, only the Baron, i.e. the local leader, could leave. Talking about the absence of hate speech and institutional violence from the authorities in the region of Zakarpattia, one of the interviewees accounted for it by stating that the Roma in the region, I quote, are different. Many Roma live in big houses. In general, people treat them more favorably. When accounting for these class distinctions, most of the Roma interviewees in Albania, Bosnia and Herzegovina, Serbia, or Ukraine pointed at poverty as a structural cause underlying such racist incidents. This is very well summarized in the following statement by one interviewee. There were some rumors in society, I quote, that Roma people from Ljubimivka look unhygienic, have an unhygienic lifestyle, and that they can potentially be carriers of infections. And when the whole society focuses on one thing, on an infection, in our case, the coronavirus disease, they may see a potential threat from people living in poverty. Hardly unprecedented, the patterns of social violence against the Roma that could be observed during the COVID-19 pandemic recall the reactions to cholera epidemics, which bourgeois elites blamed on the irresponsible behavior of the poor, with no consideration of the living conditions that rendered them particularly vulnerable to the disease. Even more so, given that COVID-19, unlike cholera, is hardly a social disease, they are also reminiscent of the violence associated with 19th-century smallpox outbreaks, which also targeted marginal minority groups. Typically ignored by the middle class, marginal groups like the Roma in Eastern Europe become important in times of epidemics due to the danger they are seen to pose to the majority population. Summing up, in a pattern familiar from historical cases of epidemics and pandemics, the Roma were blamed during the COVID-19 pandemic precisely for behaviors arising out of the poverty and marginalization in which the systemic, structural racism of societies placed these communities. As we saw in the beginning of my talk, consistent data points to the increased vulnerability of Roma communities to the effects of the pandemic compared to the majority population. Consequently, hate speech and racist incidents can be appropriately described as instances of effectively blaming the victims. Moreover, despite significant evidence of social violence against the Roma during the early stages of the COVID-19 pandemic, much more of it probably went unreported. The involvement of the authorities in perpetrating such violence makes this quite likely and reproduces the social inequalities that account for the marginalization of the Roma and their exclusion from respectable society in times of crisis. Understood in this way, the hate speech and the racist incidents on which my talk has focused represent only the tip of the iceberg, the superstructure of an architecture of oppression whose roots are firmly placed in a social inequality inflected by moral considerations that distinguish between the so-called deserving and the undeserving poor. Such a reading offers some advantages. First, it firmly positions class and poverty at the center of debates about the Roma as a marginalized minority, and more generally about groups that are simultaneously disproportionately vulnerable to and blamed for outbreaks of epidemics and pandemics. Second, it warns against culturalist arguments that, even when they are well-intentioned, can come dangerously close to the reified racist assumptions about an allegedly unchangeable nature of the Roma. As Paul Farmer notes, despite its common invocation in minority policies, cultural difference, verging on cultural determinism, is one of several forms of essentialism used to explain away assaults on dignity and human suffering. It can also serve the convenient function of taking away blame from the elite biases and multiple failures of human rights and minority rights policies and laying it conveniently at the door of the marginalized group whose situation they allegedly aim to redress. Against the evidence of the inaction of state authorities and of the systemic and structural racism embedded in such institutions, the positive stories of efforts towards knowledge production, advocacy, and activism on behalf of the Roma during the COVID-19 pandemic came almost exclusively from civil society organizations, whether Roma ones or other non-governmental groups. One of the jokes on social media in Bosnia and Herzegovina during the first 2020 lockdown went like this. I quote, "Now everyone is like Roma, like gypsies, because our children do not go to school and we don't even have a job." What the racist attempt at humor masks is a fear of social decline in an age of increasing inequality. The shrinking of economies, the furloughed workers, and the stories of those who had no stable jobs to be furloughed from expose the permanent threat of precarity implicit in a capitalism that is as pervasive a system as it is fragile. As a graffiti in Toronto bluntly put it, Corona is the virus, capitalism is the pandemic. Such stories of racialization in times of crisis remind us that anti-Gypsyism is profoundly marked by a class component. Grounded in poverty more than in any cultural characteristics, anti-Roma racism often serves to displace the majority's anxieties about rising inequality. Its persistence and visibility in times of public health crisis is an indictment of the failure of well-intentioned minority policies designed by well-meaning elites who, however, do not and cannot understand the situation they aim to redress from the perspective of the poor. In 1995, the World Health Organization's World Health Report put this bluntly. Poverty, this report shows, is the world's deadliest disease. Poverty yields its destructive influence at every stage of human life, from the moment of conception to the grave. It conspires with the most deadly and painful diseases to bring a wretched existence to all those who suffer from it. These insights were clearly not taken on board during the COVID-19 pandemic. Going ahead, it is doubtful if they can ever be, for as long as meliorative programs are designed and implemented by actors and institutions who have only a theoretical understanding of what it means to be poor.